Could you travel in the context of coronavirus? This video is based on recommendations from the World Health Organization. In this coronavirus and epidemic context, it's becoming hard to travel easily. So, what should we do in this case? Restricting travels or block them won't prevent the virus to be spread. In best cases, countries that are applying these restrictions will gain some days before having the virus declared. So, it's more important to follow proven recommendations to limit the propagation and help travelers having an effective hygiene. Let's see what are the possible actions to travel in best conditions. How to reduce your exposure to risk. Keep watching and be informed for your safety. Don't forget to share this information with your family and friends. As recommended by World Health Organization, it is prudent for travelers who are sick to delay or avoid traveling to affected areas. Particularly, for elderly travelers and people with chronic diseases or underlying health conditions. General recommendations for personal hygiene are cough etiquette. Keeping a distance of at least 1 meter from persons showing symptoms. Also consider the following recommendations: perform hand hygiene frequently, particularly after contact with respiratory secretions. Hand hygiene includes either cleaning hands with soap and water or with an alcohol-based hand rub. Alcohol-based hand rubs are preferred if hands are not visibly soiled. Wash hands with soap and water when they are visibly soiled. When coughing or sneezing, cover your nose and mouth with a flexed elbow or paper tissue and disposing immediately of the tissue. Clean your hands after disposal. Refrain from touching mouth and nose. The next topic is about medical masks. Are masks really required to protect persons against coronavirus? Contrary to received ideas, a medical mask is not required if exhibiting no symptoms. In fact, there is no evidence that wearing a mask protects non-sick persons. However, in some cultures, masks may be commonly worn. If masks are to be worn, it is critical to follow best practices on how to wear, remove and dispose of them. Hand hygiene is required after mask removal. Wearing a medical mask is one of the prevention measures to limit spread of certain respiratory diseases, including coronavirus. However, the use of a mask alone is insufficient to provide the adequate level of protection, and other equally relevant measures should be adopted. We will see these measures later. If masks are to be used, this measure must be combined with hand hygiene. Other safety measures are also required. How to use masks if needed. Correct use of medical masks is needed to make them useful. Place mask carefully to cover mouth and nose. Tie securely to minimize any gaps between the face and the mask. While in use, avoid touching the mask. Remove the mask by using appropriate technique. Do not touch the front but remove the lace from behind. Replace masks with a new clean, dry mask as soon as they become damp, humid. Do not reuse single-use masks. Dispose used masks immediately upon removal. Clean hands after removal or whenever you inadvertently touch a used mask. Hands must be cleaned by using an alcohol-based hand rub or soap and water if visibly soiled. Now that we know how to use a mask, let's see how to keep our healthy when traveling. What about food and restoration? As usual, travelers are also advised to follow proper food hygiene practices. To reach this, here are the 5 ultimate keys for food safety. Key number 1, always keep your hands clean. Wash your hands before handling food and often during food preparation. Wash your hands after going to the toilet. Wash and sanitize all surfaces and equipment used for food preparation. Protect kitchen areas and food from insects, pests and other animals. Why cleaning your hands frequently? Even if most microorganisms do not cause disease, dangerous microorganisms are widely found in soil, water, animals and people. These microorganisms are carried on hands, wiping cloths and utensils. Especially cutting boards, and the slightest contact can transfer them to food and cause foodborne diseases. That was the first key. Let's continue with the next advice. Key number 2, separate raw and cooked food. Separate raw meat, poultry and seafood from other foods. Use separate equipment and utensils for handling raw foods. Regularly clean equipment, such as knives and cutting boards. Store food in containers to avoid contact between raw and prepared foods. And this is the reason. Why is it needed to separate cooked and raw food? Raw food, especially meat, poultry and seafood, and their juices, can contain dangerous microorganisms which may be transferred onto other foods during food preparation and storage. This is why it's important to separate them. Key number 3, cook thoroughly over 70 degrees Celsius. Cook food thoroughly, especially meat, poultry, eggs and seafood. Bring foods to boiling like soups and stews to make sure that they have reached 70 degrees Celsius. For meat and poultry, make sure that juices are clear, not pink. Ideally, use a thermometer. Let's see why. Why to cook food thoroughly? Proper cooking kills almost all dangerous microorganisms. Studies have shown that cooking food to a temperature of 70 degrees Celsius can help ensure it is safe for consumption. Foods that require special attention include minced meats, rolled roasts, large joints of meat and whole poultry. Please check your food before eating. Key number 4, keep cooked food under 5 degrees Celsius. Do not leave cooked food at room temperature for more than 2 hours. Refrigerate promptly all cooked and perishable food, preferably below 5 degrees Celsius. Keep cooked food piping hot more than 60 degrees Celsius prior to serving. Do not store food too long even in the refrigerator. Do not thaw frozen food at room temperature. So keep your food safe to stay healthy. Why is it needed to keep food at safe temperature? Microorganisms can multiply very quickly if food is stored at room temperature. By holding at temperatures below 5 degrees Celsius or above 60 degrees Celsius, the growth of microorganisms is slowed down or stopped. But some dangerous microorganisms still grow below 5 degrees Celsius. So be careful. Key number 5, use safe water and raw materials. Use safe water or treat it to make it safe. Select fresh and wholesome foods. Choose foods processed for safety such as pasteurized milk. Wash fruits and vegetables, especially if eaten raw. Do not use food beyond its expiry date. Take time to select your food carefully. Why is needed to select raw materials with care? Raw materials may be contaminated with dangerous microorganisms and chemicals. This is also including water and ice. Be warned that toxic chemicals may be formed in damaged and moldy foods. Take care when selecting raw materials. Simple measures such as washing and peeling may reduce the risk. These 5 keys should be followed to reduce contamination risk and let you safe in many cases. Finally, keep informed by using your local media and government instructions. The knowledge is the key for prevention. And prevention is better than curing. Please subscribe to our channel and activate the bell to receive notifications when next videos will be published. Don't forget to like and share this information with your family and friends to help them being safe. Thank you for watching and take care on your health. Travel in safety.